Hello and welcome to Beating BDD, a new podcast about body dysmorphic disorder from the BDD Foundation in the UK. My name's Claire Atherton, and in this first episode I'll be speaking to Rob Willson. Rob's a London-based CBT therapist who specialises in researching and treating OCD, BDD and health anxiety. He's trained to supervise other CBT therapists and co-authored several books such as Overcoming Body Image Problems, including Body Dysmorphic Disorder. Rob's also chair of the BDD Foundation, the world's first charity exclusively devoted to BDD, which makes him the obvious person to kickstart this podcast. Here's what he had to say about how to recognise and treat the disorder and what to do with all that spare attention when you're cured. So, hi Rob, thank you very much for being the first ever guest on Beating BDD for the BDD Foundation.
Hi Claire, thank you very much for having me.
You're very welcome, and a special thanks for agreeing to be interviewed in a hermetically sealed room with no fan on one of the muggiest days of the year. That's special. Kudos to you.
Thank you.
I thought, as you're the chair of the BDD Foundation, it might be interesting if you could tell me a little bit about the work of the foundation and also how you're hoping that the podcast might support that work.
Well, we are currently the world's only charity exclusively devoted to individuals that are affected by body dysmorphic disorder. And our primary function really at the moment is to raise awareness and provide very good quality information via our website. And we have a number of projects we're working on, particularly one that's exciting this year is a project to go into schools and help to raise awareness and hopefully help people to identify the problem much earlier. And at the end of this year, we are excited that we've got our third conference. So the big hope for the podcast for me is that we can hopefully increase people's interest in the foundation, help raise awareness of the work that we're doing, as well as, of course, about the condition in general. And the big hope for any chair of a charity is that people will be inspired to go out and raise some funds for us so we can do bigger and better things. Yeah, they're all laudable aims. I would just add, for me, I think the really key thing is to be able to get some recovery stories out there as well, because I think it can be really difficult if you're affected by BDD to actually believe that there's light at the end of the tunnel. So I think that would be also a really great outcome. Yeah, that'd be fab.
Yeah. So as it's the first ever episode, I thought maybe we could start with you talking through the disorder a little bit, the signs to look out for, treatment options, those kinds of things. So
absolutely.
So to start with diagnosis then. So if someone came to see you with suspected BDD, what would you be looking for in terms of behaviour and thought processes?
Well, I think that it's important to recognise that the key thing here is that we are dealing with a disabling condition. So first and foremost, we're looking to see someone suffering from clinically significant levels of distress. They feel very ashamed or anxious, maybe some depression, so strong negative feelings, and that those feelings are causing interference in the person's life. So they may be having a hard time getting to work, to school, to some other form of education, or they're not able to socialise or date, or engage in hobbies and interests. So really the key thing first is we're looking for a problem that is both distressing and disabling. In the case of BDD, this of course means the person's focused upon an aspect or aspects of their appearance that they believe are ugly or disgusting or not right. And in the diagnosis, the question is that concern almost completely imagined, in the sense that other people can't see the flaw in their person's appearance at all, or if there's a minor anomaly, a minor flaw in appearance, then the person's concern is very much more excessive. So we're really looking for whether someone's preoccupied with their appearance alongside their distress, and by that we mean that the person is concerned about their appearance for more than an hour a day, although it's usually many, many hours of the day.
That's really interesting. So how might you, if you were to talk to a healthy person who might just have normal types of appearance concerns, how might their level of preoccupation compare with that? What would you consider normal in terms of amount of time a day to spend worrying about your looks?
No, it's a good question. In the literature, the cut-off is If it's more than an hour, then you're probably into more of a problematic zone. If it's less than an hour, we think you're closer to the healthy side. But the truth is that in individuals with BDD, they're 5, 8, 10 all day hours. And people with healthy body image, they might have the odd moment during the day when they look in the mirror and think, dear. Or really should drop some weight, or I really should reapply my makeup, but it's minutes. And it might be that there are certain occasions when there's more focus on their appearance, so they're more worried, like a job interview or a date or
Wedding,
meeting someone's parents. So it's much more flexible as well. So that whereas BDD, it's very often day in, day out.
Okay, yeah, no, that's a really clear distinction. Can people of any age or gender be affected by BDD?
Certainly. BDD affects people from all kinds of walks of life, all ages and all genders. There is a fraction more women appear to suffer from BDD than men, although it's not far off 50-50. And I think in the clinics we see mainly younger people in the sort of mid-20s, mid-30s, early 40s kind of bracket. But certainly, you'll meet people who have had BDD for almost all of their life.
So what do we know about how the disorder develops? Is it something that comes about as a result of experience, or is there such a thing as a BDD brain?
It's the $6 million question for any psychiatric problem, really. But BDD has really suffered from a paucity of research. But what we do know is that perhaps there is an interaction between certain, perhaps, brain tendencies and capacities, personality types, and some experiences. So we know from some of the research that people with BDD have quite high performance brains in some ways. So these are people who have a very good eye for detail. They've got a very good eye for what's beautiful and is aesthetic. They may even have a better capacity to see the differences in different kinds of shades of colour. So you've got some brain traits which would make you a brilliant architect, graphic designer, artist. And we know that these kinds of trainings and occupations are overrepresented in samples of individuals with BDD. And we also know that if you're inclined to be somewhat perfectionistic and have very high standards and self-critical in your personality, that can be a risk factor. And further to that, in terms of life experiences, we know that if you've been bullied or teased or abused in your earlier life, that is also a vulnerability factor for BDD. So it's really important to understand that anything that perhaps has made the person feel different in their early life, particularly when they're emerging into adolescence, something that makes you feel perhaps stigmatised in some way, that drives stronger feelings of shame and greater fear of ridicule and humiliation, and that seems to be quite an important factor in developing BDD too.
Yeah, sure. Can you actually see on a brain scan how someone with BDD's brain is different, or that kind of high-performance brain is different?
You can. There's a chap called Jamie Fusner who's done some really fascinating studies, even showing that in fMRI scanners that people are better, their brains are reacting differently to upside-down faces. That people with BDD are better at recognising upside-down faces than the average person on the street. So there's some hyperactivity in areas of visual processing, which is very evident in the brain scan study. So something definitely is happening in the brain.
Very interesting. So once someone has developed BDD, why doesn't it go away of its own accord? What maintains it?
Well, that's another really interesting question, because the average person with depression, probably after about 6 months or so, it's likely that their depression will have probably passed largely of its own accord. Whereas problems like body dysmorphic disorder and OCD tend to take a chronic course unless they're treated properly. And that partly seems to be that you've got some very powerful maintaining mechanisms in BDD. You've got, once you're into a pattern, and the real challenge here is that once you've been doing something for about 6 months, your brain starts to do these things on autopilot. They become habit. So if you've been checking for a while it becomes quite natural and automatic to check in the mirror in a certain way, or to focus your attention onto flaws and interrogate your appearance in some way, or to camouflage and conceal, to avoid certain situations. And the big challenge for us all is once you've developed a habit, it can take quite a lot of effort to then counter that habit and to stop it. So doing nothing isn't really a viable option, because it won't necessarily just take care of itself, which is great when we learn to walk or to drive. The habit just doesn't melt away of its own accord. But it's not so helpful when you have an emotional problem like BDD, and therefore you're going to need to take quite a lot of action to counter it and to combat and stop those habits.
Yeah, absolutely. I always find it quite ironic that if you have BDD and you really think you're ugly, that you're then expected to believe it's not your looks that are the problem, it's a preoccupation with your looks that's the problem. So how often do you come across that, and how do you deal with it?
That is the central issue in many ways. What's interesting is that very often the time when people are most convinced that they had BDD is when they've recovered from it, because they then realise that they don't look so bad, that they're pretty normal and actually they're all right, really. And they then look back and wonder what on earth was going on and why were they so preoccupied and so distressed. But that makes sense, because